right, here we are back at it with a CPR lesson. Again, if you have any questions, you can email the teachers up there. You can see also, make sure you check Google Classrooms frequently. So we're going to hop into the full screen and we're going to talk about CPR with an AED. Now, I do realize that given the situation, you don't have a CPR mannequin, so it's very difficult to practice hands-on, but we're going to go through the informational portion of the lesson, and the written tests will be based off of this information. And we're first going to talk about what CPR stands for. CPR stands for cardiopulmonary resuscitation. CPR is when one or more individuals breathe and pump blood for an unconscious victim. CPR saves lives, especially if it's administered immediately once a person collapses. So who should know CPR? Everyone. Everyone should know CPR. Now, you don't have to be CPR certified in order to save lives. Knowing CPR can still enable you to save people around you, people that you love, people that you care for, or people that just happen to, have some issues when you're out in public. Is a person who is CPR certified required to administer CPR to an unconscious victim? The answer to that is no. An individual should only perform CPR if they feel comfortable in the particular situation. There are issues where someone may be bleeding, the scene may be dangerous, and you just don't want to go into that scene, and that is up to you to decide. You never want to put yourself in harm's way. You could also carry what's called a face shield, and they can be placed on a wallet, or in a wallet, I should say, or on a keychain. I actually have one on my lanyard at school. I don't have it now to show you, but it's very small. It folds up. You can put it right on the keychain. It's inside of a plastic bag, and it works as a one-way valve. So you open the plastic bag, lay it over top of the person's face, and you can breathe in, but they can't, spit or vomit up through the one-way valve. You can only breathe in. So in that situation, you're good to go. It keeps you safe. So the American Heart Association decided to do a survey because they realized that there were so many people that knew CPR, but they weren't acting in rescue situations. They wanted to find out why. So they figured out that people were scared to hurt the victim, but you have to remember that that person is not breathing and they don't have a pulse. So they're clinically dead. If you do nothing, they're going to die. So one of the things that is often preached to us as teachers of CPR, they'll tell us to, tell our students that a person would rather be alive with broken ribs than dead with intact ribs. And that's kind of how you have to look at it. You are oftentimes going to break the ribs when you give CPR, when you give compressions, but that's normal. And again, someone would rather be alive with damaged ribs than, dead with intact ribs. Also, people are afraid of disease. So again, like I said, face shields can be used as a barrier, but giving rescue breaths opens a person up to an increased chance of getting some type of disease from another person. So what the American Heart Association did was they took a look at what's called hands-only CPR. And this is when you just deliver compressions. And they found out that chest compressions are better than nothing. In fact, chest compressions are more important than they originally thought after going through this experiment. So hands-only CPR reduces the risk of the disease transmission from one person to another, which is great. It will allow people to act in a CPR situation and feel more safe that they're not going to put themselves in harm's way. And hands-only CPR works because the oxygen still is in the blood. So as you are pumping this person's blood, pumping their heart, allowing for this blood to circulate, it still has oxygen in it. So you're still getting oxygen to the cells, and the hands-only CPR still works because of that. And we're going to take a look at a couple videos right here so you can get a better idea as to what hands-only CPR is and some of the situations where this might occur.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA-4CPR or visit heart.org/handsonlycpr.
So we're going to talk about the acronym CAB. And previously, before recent studies, this used to be ABC. But again, like I said, they found that circulation was the most important. So what they did was they organized the acronym in a way that reflects the things that are the most important in CPR. And circulation is the most important. So getting those compressions going. All right, so circulating that blood. The airway is the second most important. And this refers to what's doing the head tilt chin lift maneuver. And this is when you place your hand on the top of the forehead and just underneath the chin and tilt the head back while opening up the mouth. This allows for the airway to be open as the person is laying on their back. It allows you to administer rescue breaths, and it allows for the person to breathe easier. And breathing, that is the third most important, which is giving 2 rescue breaths during a head tilt chin lift when the nose is pinched off. Now, when you give rescue breaths, your eyes want to be down the chest. So I want to give rescue breaths, keep my eyes down the chest, see if the chest is rising, and that's going to indicate to me that the breaths are going in. If I notice that the chest doesn't rise, I may also feel the breath blow back on my face as I breathe into the victim. What you want to do at that point, if the breaths don't go in, put the head back to neutral and then perform the head tilt chin lift again. If you breathe into the victim and you notice that the chest again doesn't rise, you can look into the mouth and see if you can visually spot something that is blocking the airway. If I can see something, I can take that object out of the airway and at that point deliver rescue breaths. If I don't see something inside of the airway, I never want to do what's called a blind finger sweep. So I never want to put my finger into someone's mouth and try to fish something out that I can't see. In those instances, it often will make the situation and the problem worse. So you'll probably push the object, whatever is in there blocking the airway, down further, and it will make the situation worse. So you want to avoid that at all costs. So we're going to get a little bit more in depth with some of these things here. So compressions, they should be done 2 inches deep into the chest. This will allow for a proper contraction of the heart in order for you to pump the blood of the victim. So the visual landmark, you want to be in the center of the nipple line or just in the center of the chest, right on the sternum. And again, it's important to compress the chest 2 inches deep. You want to press hard and fast at the rate of 100 compressions per minute. And the force should come from your entire body. All right, so you don't want to bend and flex the elbows. Your elbows should be locked. You should have one hand on top of the other using the heel of your hand, and you're using your whole body weight to compress the chest as your elbows are locked. It's not like a tricep extension like we learn in the weight room where you're using your tricep and bending your elbow. That's not what you want to do. You want to use the force of your whole body while locking out your elbows. And this will allow you to compress the chest more consistently. And it also will reduce fatigue. If you try to give compressions all with your upper body, you become tired very quickly. And compressions, when done properly, are still very taxing. You can become tired very quickly. It's very important to have someone close by in order for you to switch in and out, but we'll get to 2-person CPR in a little bit. Also, you want to allow for the chest to completely recoil. So what does that mean? You want the chest to come back up into a neutral position. And when you do that, you don't want to lose contact with the chest. So you're not going to compress and then pull your hands away. All right, you don't want to pull your hands away from the victim. You always want to keep contact, but you also do want that chest to completely recoil. So the airway, again, like we stated, make sure that we perform a head tilt chin lift. If you do use a bag, you want to make sure that it's tightly sealed. Typically medical professionals will come in and use a bag. If you go into the medical field, you'll get more training utilizing tools. But what we're going to focus on is hands-only CPR and rescue breaths. So when giving breaths, you want to give even breaths. Again, it's 2 breaths to 30 compressions when we do get the CPR. Again, that's 2 breaths to 30 compressions. What comes first? What's most important? The compressions. So if you want to think about it, the ratio would be 30 to 2. So 30 compressions, 2 breaths, 30 compressions, 2 breaths. You want to make sure that you form a tight seal around the mouth, pinch the nose off, have your eyes down the chest to make sure that that chest is rising with your breaths, and deliver your breaths in that way. We covered about the blind finger sweep, so remember, don't ever reach into the victim's mouth if you can't see the object. So we're going to talk about an AED. This is an automated external defibrillator. So an AED walks you through all of the steps of CPR. That's one of the benefits. An AED has many benefits. It also will analyze a heart rhythm and will monitor whether or not this person would benefit from being shocked. So it allows for a shocking of the heart to try to sync the rhythm up in order to allow for the heart to beat efficiently. And an AED can measure that. And we'll take a look right here at an AED pad. This is an actual AED pad. This is what you will see when you open it up and administer it to someone who is in a rescue situation. And you can see that the pad shows you exactly where you're going to place the pad. And this is extremely important because in a life-saving situation, many times, an individual's mind has a tendency to not be able to focus, and the AED makes things super simple for anyone who is trying to save someone's life. For us at SCVTS, our AEDs, we have 3 of them. One is located outside of the gym. There is one in the weight room, and there's one up, I believe it's A-wing by the office. So those are the 3 that we have. I do believe that the athletic trainer also has one, so that may be 4, and the nurse, so that may be 5 total in the school. Don't quote me on that, but those 3 are available that I just talked about to anyone in the school if there ever happens to be a situation where an AED is needed. So we're going to talk about the steps to CPR. And the first thing is to check the scene and then the responsiveness of the victim. If we go into a situation and we check the scene and it's a situation where I'm going to get hurt going in as a rescuer, all I do is call 911. I do not enter that scene. All right, when medical professionals, they often will tell people we'd rather save 1 life than 2. So if there's a situation where you're going to get yourself hurt, the advice is to not go into that situation. So that's where everything stops. If the scene is safe, say someone passes out in a park, everything seems fine, I can go in and help this person. All right, that is a situation where I then check the responsiveness of the victim. The way that you do that is by doing what's called tapping and shouting. So I would just tap them on the shoulder and shout, "Hello, are you awake? Hello, wake up, wake up. Hello, can you hear me?" Things like that. And you don't want to, slap a person, grab them, by the throat. You don't want to do any of that stuff. Again, just tap their shoulder. You can tap them, somewhat hard on their shoulder. The shoulder's pretty resilient, to make sure that they're, not just sleeping or there aren't, other issues that might be going on. They may wake up and be like, "Dude, what are you doing?" There have been situations where people go into CPR prematurely and the person's like sleeping on a bench. All right, so make sure that you tap and shout. All right, but first, check the scene. All right, so if you are in a situation, the person is unresponsive, you check the pulse on the neck. Remember, always check the pulse on the same side and don't use your thumb. Your thumb has a pulse of its own, so if you press really hard with your thumb, you'll actually feel the pulse of your own thumb. So use your 2 fingers. If the person doesn't have a pulse, they're not breathing, send someone to call 911 and to get an AED. Then you want to follow the steps of CPR. We already talked about that. The steps of CPR are 30 compressions and then 2 breaths during a head tilt chin lift. You want to hook the victim up to the AED and follow the prompts outlined by the device until help arrives. And the steps that the device will give you are very simple and self-explanatory. It actually will pace you through your compressions and it will let you know if you're lagging behind or if you're on a good pace. We're going to take a look at an AED in use right here.
In this video, I'm going to demonstrate how to use an automated external defibrillator. In previous video clips, you've heard me mention an AED or automated external defibrillator. Now I'm going to show you how to use one. These are wonderful machines which have made a huge difference in the recovery of cardiac arrest victims. Don't be nervous, it's really very easy to use. Research shows that more than 95% of cardiac arrest victims die before reaching the hospital. A victim's chances of survival are reduced by 7 to 10% with every minute that passes without CPR and defibrillation. Few attempts at resuscitation succeed after 10 minutes. Nearly 60% of all cardiac arrests are witnessed. So if an AED is nearby, there's a better chance for survival if timely defibrillation occurs. In cities where defibrillation is provided within 5 to 7 minutes, the survival rate from sudden cardiac arrest is as high as 30 to 45%. Other examples show survival rates as high as 86% in some cases. Step 1. Turn the AED on. Next, take the lid off. Pads, scissors, a razor, and gloves will be tucked inside the lid. The AED will then audibly prompt the rescuer.
Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyze it. Shock advised. Press flashing shock button. Shock delivered. Start CPR.
So just listen and follow directions. The pads have a diagram on them indicating where to place them. But before you can do that, you will notice that scissors are provided to cut the victim's shirt off. If your AED doesn't have scissors, tear the buttons off the shirt. If the victim has a hairy chest, use the razor supplied with your AED to shave the area where the patch is to be applied. And if the victim is wet, use clothing or a towel to dry his or her chest. It's not necessary to be totally dry though. If the AED advises you that shock is advised, it's important not to touch the victim during the shock. It will loudly say,
Shock advised. Don't touch patient. Press flashing shock button.
Then push the red heart or electric bolt button once. The AED will prompt you by saying, Rhythm restored, or
Shock delivered. Start CPR.
After every 5 cycles, or about every 2 minutes, allow the AED to analyze the rhythm and continue CPR until the emergency medical team arrives.
So we're going to talk about the recovery position, and the recovery position is used for someone that is breathing successfully, they have a strong pulse, but they're unconscious. And we want to make sure that these individuals are placed on their side, and you want the upper limbs on the same side as the face. So you can see that the upper leg is on the same side as the face, as well as the upper arm. This is going to ensure that the person doesn't roll onto their back. If their arm was behind them or their top leg was behind them, their hips would have a tendency to open up and they would roll onto their back. We put them in this position in order to limit the possibility that they would vomit and then choke. So when they're on their side, the vomit would then roll out of their mouth and they're in a much safer situation. So we're going to talk about two rescuer CPR. And we're going to refer to these rescuers as Rescuer A and Rescuer B. So you and your friend, you are going to be Rescuer A. So you come up to a scene and you notice that someone is passed out and the scene is safe. You tap and shout and there's no response. So you know that this person needs CPR. So you as Rescuer A, you tell your friend, Rescuer B, call 911 and go get an AED. So they call 911 and they go and run off to grab the AED. Say you're in a park and there's an AED over by the water fountain and they have to, run across the field in order to get it. So Rescuer A, which is you begin CPR. So you give them 30 compressions and then 2 breaths. And you continue this until Rescuer B approaches you with the AED. Now, as Rescuer A, you do not stop giving compressions and rescue breaths. Rescuer B will work around you in order to put the AED pads onto the person that's receiving CPR. So again, you never stop. The person will wait for you to give breaths. They'll quickly attach the pads, and then you will follow the prompts to the AED. So the AED will kind of guide you through it. You never stop CPR to administer the AED. You want to continue CPR as much as possible, and Rescuer B, again, will work around you. Once the AED analyzes the heart rhythm, it'll tell you to back away, it'll analyze, and then it'll tell you to begin 5 cycles of CPR. And then when you go in to give CPR, Rescuer B will then give compressions, and you, Rescuer A, will give breaths. And you'll switch every 5 times, you will switch. And the reason why we do that is to allow for each individual to regain some of their stamina when they go back to giving compressions. Giving compressions is much more taxing. So if we're able to rotate every 5 times through, we're going to make sure that both rescuers keep their breath and they can stay fresh while they're giving compressions and rescue breaths. So we're going to go over some questions here. Can a person be sued for performing CPR? The answer is no. There are Good Samaritan laws that are in place. So if a person in good faith goes to give someone CPR who is passed out and needs it, you will not get sued if they do not survive. So we have some review questions here. You can see them on the screen, but I'm actually going to put these into an assignment type of file, which you can grab right from the lesson that is posted in Google Classroom. So that is it for adult CPR. We will continue with child and infant CPR as well as choking in the next lesson. If you have any questions, be sure to shoot me an email. Again, the emails are up top, not only for me, but the other phys ed teachers. And remember to check Google Classroom frequently. Thanks for checking in, and I'll talk to you soon.